Good evening and welcome to my Zoom presentation, Pain Management Without Medication. Now that sounds probably a little bit funny, and we will get into this subject, but first let me introduce myself. My name is Tom Burns, and I am a hypnotherapist, and I have used pain management on myself, and I've helped others with pain management. And you're wondering, what is pain management? Well, before I start, let me just say one more thing. I have sent out surveys to everybody that has attended this evening, and if you would like to send the survey back filled out, I will have a drawing for a complimentary session. So, now what is pain management? Well, pain management is not taking away all the pain. Pain management is dealing with the pain, learning to understand your body and the pain itself, and learn to feel as the pain starts getting more intense. And then we have techniques that we will talk about that will help eliminate some of the pain. Pain management does not take away all of the pain. And you're probably wondering, well, then it's not as good as medication, because medication, I can take a pill and I don't feel the pain. Well, this is true. You don't feel the pain for a little while. But do you feel a little groggy? Do you feel a little flighty? Do you get as much done as you would in a normal day without pain medication? The answer is probably no. Well, with pain management, what we do is we control the pain, because if we understand what the pain is, then we can control it before it gets so severe that we can't do anything. Pain management will allow you to have a good, busy life. And we have two tools that we use, and one of them is guided imagery, and the other is hypnosis. Now, I'm sure there's questions swirling around in your mind. Well, let me talk first about guided imagery. Guided imagery is a daydream. Has everybody ever had a daydream where you are in a moment from the past and you can see the entire scene in your mind? Well, that is guided imagery. Or have you ever woken up in the morning and you've been dreaming and you can still see some of the dream in your mind and it seems so vivid? That is guided imagery. In meditation, where you just kind of get so relaxed that your mind just shows you different things, or the intention that you were meditating on, and all of a sudden you start seeing different pictures and such. That is guided imagery. And hypnosis, well, I'm sure everybody's either seen a Hollywood movie that had a serial killer that had been hypnotized and now he's chasing everybody that he sees, or you've seen a hypnotist on stage and you've seen people cluck like chickens or stand there thinking that they're naked in front of everybody. Well, the Hollywood is drama, and they have to do drama to have you be interested in the movie or the show. The hypnotist, he's looking for people that are susceptible to hypnosis. And when I say susceptible, that he interviews people well before the show, and he's looking for those people that want to be on stage so bad that they're willing to just accept anything and everything he says. So when he chooses people, he will give them suggestions prior to the show. And then when they come on, he will give a couple more suggestions to get them deeper into trance. And so then, they were of a mind that they were willing to do anything and everything to get on stage. So when he says, I want you to sound like an alarm clock, well, by gosh, that's what they do. Or cluck like a chicken. So that is not hypnosis. Hypnosis is where we relax you. We start with breathing. We take you through a couple of different steps just to get you to relax. And as you relax, your conscious mind becomes distracted or just kind of relaxes. And your subconscious mind is ready for suggestions. Now, that's the important part. All the things that are going to occur with the subconscious. All the suggestions. And everything with hypnosis is positive. And the biggest thing to know about this is at any given point, you are always under control. If something is said to you that goes against your core beliefs, your conscious mind will pick up on that and make the decision that is right for you. So this is not any type of mind control or anything like that. All we're doing is distracting the conscious mind from making constant decisions all the time and allowing the subconscious mind to listen. So now, at the end of this presentation, I will answer any and all questions about hypnosis, guided imagery, anything that bothers you about it, because the second half of the session is going to be, we're going to go into trance as a group. I have a script, and we won't do it until everybody is comfortable. And honesty is the best policy here, because I truly want you to be understanding and okay with doing this. So, I want to bring up a project that was done with Southwest Institute of Healing Arts and Banner Hospitals, the Estrella branch. And it was a program that started in January of 2015. And patients were offered 15 to 20 minute sessions. We've guided imagery sessions for pain, stress, and nausea. The effects of guided imagery, it's a non-evasive modality. It is without any effects. It's just pure relaxation. It gives the subconscious mind the opportunity to go and listen and take suggestions. So anyway, like any new project, when this came into the hospital, doctors and nurses were skeptical about this entire program. But with having some meetings and some on face-to-face experience, we had a lot of doctors and nurses that saw the value in doing this. over 6 months, the pilot project saw 221 people. And patients had the opportunity to pick one of 5 scripts that they would like. And then we had a volunteer hypnotherapist that would do a session with them. After the 6 months, pain levels were reduced by 42%. Stress levels were reduced by 52%. And nausea was reduced by 56%. These are incredible numbers. And it's an ongoing program. Some of the methods that were used were, as I said, the 2 tools, guided imagery and hypnosis. Volunteers from SWIHA were there to do the 15, 20-minute sessions. And again, patients had the opportunity to say yes or to say no. And they were given their choice of script that they would like to have done with their session. The sessions were free, and all the sessions were very positive. With some of the results and conclusions, patients were asked if they felt this impacted their view of Banner Estrella Hospital, and 75% said it had enhanced their view. Patients were also asked if guided imagery should be part of the treatment procedure. 100% said yes. Banner leadership stated that they were happy to participate in the guided imagery trial program, and they strongly supported the integration of this program into all areas of Banner. Now, this evening I've talked about pain management. With hypnosis, there are a number of things you can do. Pain management is one. Pain management is in cancer treatment now. It's with so many different diseases, and it's amazing the positive reactions that are coming from the patients. Where can guided imagery be used? Well, are you stressed? Do you nail bite? Maybe you're thinking of quitting smoking or weight management. To change habits? Depression? Relationships? It can go on and on and on. So this evening, I wanted to just inform you about one important facet, which is pain management without medication. I've given you some interesting numbers that are all positive. I've also offered you other ideas that you could use hypnotherapy and guided imagery for. So now, before we go into question and answers, I want to just let everybody know, once we finish all the questions and everybody's happy or understanding or is gotten their questions answered, we will have a session. After the session, I will provide you the script that we're using. I will also provide you a sheet on how to do self-hypnosis. And then we can have a 5 or 10 minute session to go through that. So, I will stop talking on the presentation now, and we will take over and do questions and answers. Thank you.